Good afternoon. The purpose of my presentation really is to just give you a sort of quite a high-level overview of what the current situation is, both nationally and regionally and locally. I'm going to talk to you about the government's action plan and what underpins that action plan. I'm going to talk to you about some of the social distancing measures and why they are important. Do a very brief overview of what the sort of emergency planning arrangements are nationally and locally, and then finish with some sort of key points for yourselves as elected members. So you'll appreciate that this is a really rapidly evolving situation. But as of the end of last week, we had about, in excess of 44,000 people had been tested nationally, and over 1,500 of those had been confirmed as positive cases. Now, a couple of weeks before that, I would have been able to tell you that between 1% and 2% of people who'd been tested had come back as positive. But you'll realise from those figures that actually now it's between 2% and 3%, and as this epidemic progresses, the proportion of people who've got infection will increase. So last Thursday, the government shifted its approach from one of containment to one of delay. And the announcements that were made last week were that anyone with symptoms, and the symptoms are basically either a temperature or a new persistent cough, so anybody who had these symptoms should self-isolate for 7 days. And whereas before we had some really complicated things to consider around travel history, so had people been to China, had they been to Wuhan, had they been to specific parts of Italy, all of that was taken into consideration. Actually from last Thursday that all went out the window, and the case definition became very simply anybody who had either of those two symptoms. The other additional advice which came out was around advice for people over 70 with long-term conditions to avoid cruises, and thirdly a ban on all overseas school trips. The other significant change last Thursday was around testing, because whereas up until then we've been doing some really robust identification, isolation, contact tracing and testing, from last Thursday testing was restricted largely to people who'd been admitted overnight who had symptoms of pneumonia or acute respiratory distress syndrome or an influenza-like illness. So obviously the testing really sort of fell substantially as of last Thursday. So all of that routine testing of people at home sort of came to a halt. Since then, well, between then and Monday, a whole raft of guidance has come out, and to be honest, we're struggling to keep up with the guidance which has come out because there has been so much of it. But I think, key for us as a local authority is some guidance around staying at home and what self-isolation at home means. There was some updated guidance which came out for residential care, supported living and home care, and that was really essential to support our social care providers. There was updated guidance for educational settings because there was a bit of inconsistency between last Thursday and now, so that has been sorted out. There was guidance around shipping and seaports, and obviously we've got two ports in Berwick and Blyth, so obviously there's some action there about checking to assess the health status of ships when they come in. So there's a requirement for ships to actually declare their health status when they come into port. And then very recently there has been some updated guidance on social distancing, and how we protect older people and vulnerable adults. Now, obviously, yesterday, all of that guidance changed again, and again, it changed quite considerably. So the guidance now is that rather than before, when it was just individuals with symptoms who self-isolated for 7 days, now anybody who has symptoms, and in fact the whole of their household, has to self-isolate for 14 days. And the reason why it's gone up from 7 days to 14 days is that the first 7 days is to cover the symptomatic period for the individual who became symptomatic initially, because we know that actually after 7 days the risk of them transmitting the virus to somebody else actually drops off quite significantly. So the second 7 days is to make sure that we pick up all of those people who may have caught the virus whilst living with somebody who has the infection, and that sort of 7 day period is to make sure that we identify those people who have been infected, so they then have to continue a self-isolation period. The other advice was about stopping all non-essential contact with other people, and this is all about keeping away from both small and large gatherings, looking at how we can work from home, reducing unnecessary or not undertaking unnecessary public transport, so basically reducing our contact with other people as much as we can. And then before the weekend, we expect some very specific advice to come out for people over the age of 70 and people with long-term conditions. And in fact, there is advice already on the government website about the really special precautions that those people need to take. And in that definition of people with long-term conditions, it's basically all of those people who would normally be eligible for a free flu vaccine. So that's people with chronic heart disease, chronic lung disease, liver disease, kidney disease, diabetes, neurological conditions, and pregnant women. That's not an exhaustive list. There is a much longer list in the guidance. And also, the advice is still that schools will stay open. This will remain under review, but at the moment the advice is that schools will stay open. So this just gives you a bit of a snapshot as of the end of last week as to the sort of distribution of cases across the region and across the country. So what this is telling you is that there is quite an even distribution across the UK, and although there are a larger number of cases in the southeast and London, I guess we'd expect that because actually, there is quite a large population in London and the southeast. But I think this is what makes England and the UK a little bit different from Italy, because in Italy the cases are very much still orientated in those specific areas of northern Italy. This is what we call an epidemic curve, and basically all it does is track the number of cases as the days progress. So you can see from that top graph, which is basically looking at cumulative cases, that the peak is starting to increase. So we're getting an increasing number of cases in the UK. And that's because we've got to a stage now where we have got community transmission within communities across the country. So the National Action Plan is really based on 4 major areas of activity, and that's contain, delay, research and mitigation. So the containment phase was the one that we've just come out of, and that's where we took a really robust approach to identifying people quickly, isolating them, testing them, and then doing an extensive contact tracing process so that we could actually identify all those close contacts and give them specific advice about what to do if they develop symptoms. And that's nothing new. That is just good public health practice. That's something we do all the time for infectious diseases that have any sort of public health impact, but probably not on the scale that we've been doing it for the last few weeks. The delay phase is where we are at the moment, and the purpose of the delay phase is really to push this epidemic peak, and I'll go on to explain what that is. It's really to push that epidemic to the right and also to flatten the peak. There's a number of reasons why we want to do that. Firstly, we know that a lot of hospitals are under a lot of pressure over the winter. So if we push the peak of these cases into the summer months, then the likelihood is that they will have more capacity to be able to manage the infections which come through the health and social care services. Secondly, coronaviruses are a family, and this particular virus, we can think of it as a new member of a family. And obviously when you have a new member of the family coming to live with you, it takes a while for you to understand how they work. And so by pushing this epidemic to the right, we get a better understanding about the virus and how it's transmitted and the number of people who are infected by one virus. We get a better understanding about the people who are infected and the people who are particularly susceptible and how it's spreading along our communities. And all of that information means that we can manage the epidemic better. And there's also something around potentially seasonality. We know that coronaviruses, there might be some seasonal aspect to it, so it could be that if we again push it into the summer, that actually the fact that we are living in better ventilated areas, we're more likely to throw our windows open in the summer, and nature will take its course and push the virus out of our homes. So the research bit, that's really, really important, and this is really, I suppose, orientated at about three things. It's about vaccines, diagnostics, and drugs. So vaccines, unfortunately, take a very long time to develop. There is a really long sort of process to go through to get any drug license, particularly a vaccine. So to get a vaccine within 12 months is, probably quite unlikely. And I guess if this was, something like Ebola, which, the mortality rate is really high for Ebola, we might be prepared to cut some corners, but actually, let's be very clear, this isn't Ebola. And so we do need to go through all of the safety processes to get any sort of vaccine licensed. The second priority is around diagnostics. So at the moment we've got a test which tells us that people have got the virus, but we don't have a test which tells us that people have had the virus. And actually, in terms of monitoring this particular infectious disease, getting a better understanding about the people who have had the virus would be a real game changer in terms of being able to manage the epidemic in a way which minimises suffering, saves lives, and reduces the impact on society. And that's where a lot of the emphasis is going at the moment. And of course, we want to get a better understanding about how we can clinically manage people who are unwell. And we know that Tamiflu, for instance, which is the drug which can be used to treat and prevent flu, we know that that doesn't work for this virus. But there are some drugs that potentially might be beneficial. So some HIV drugs, for instance, might work. And there are all sorts of other drugs which are used for completely different purposes, which we might be able to repurpose into treating this infection if we find that it has some sort of positive impact. And then the final phase is around mitigation, and we're in the mitigation phase when we're sort of in the 3 weeks around the sort of peak of the epidemic. And this is really about ensuring that people who are ill get the very best care and support that we can provide for them. And it's also about flexing staff and resources within health and social care so that we can concentrate on those people who need the support that this virus will impose. So I'm just going to talk about this sort of epidemic curve and these sort of delay tactics a bit more. So this sort of orange curve, that's what the epidemic will look like if we do nothing. So you'll see that the peak is really high, so the number of cases at the peak of the epidemic, and at the moment we're anticipating that that's going to be at the end of May, beginning of June. That peak is really high, so lots of cases, albeit in a maybe a relatively short period of time. But actually, if we push that curve to the right and we flatten it, so we extend the period of the epidemic, but actually we reduce the number of cases that we're having to manage at the peak, that will make it much easier for us to manage the vast number of cases that we might see in a way which means that our health and social care services are not going to be overwhelmed. So if you can imagine that there's a line running across here, which is the capacity of our health and care services. If we do nothing, clearly they're going to be overwhelmed. If we do these delay tactics, there's a really good chance that we will be able to flatten this curve so that it is much more manageable. So there's been a lot of talk about these social distancing measures, and basically all social distancing measures are a way to keep people from interacting closely so that they are less likely to pass this infection on to other people. And again, this is just normal public health activity that we do for a lot of other infectious diseases. So, if you have an upset stomach, then we would expect people to, stay at home for 2 days, or stay at home until 2 days after their symptoms had resolved, and that's, that is a social distancing measure. But for this particular epidemic, social distancing could include a whole raft of interventions, from preventing people or stopping mass gatherings to asking specific groups to stay at home. But I think from this point of view, or from the point of view of this particular epidemic, the government keeps talking about this being a marathon, not a sprint. And we are talking about some of these social distancing measures being in place for months rather than weeks. So when we're considering which ones to put into place, it's always going to be a balance between the impact that it has on the epidemic curve and the impact that it has on society. Because clearly we could have an intervention like mass gatherings, actually, which for COVID-19, we're not convinced that actually that's going to have a massive impact on the epidemic curve. But obviously it does have an impact because it commits resources like fire and rescue, like the police, to support events when actually we'd rather put those resources somewhere else, particularly when we're looking at potentially 1 in 5 of our employees being off at any one time. So there's a balance to be made. I think the timing is critical. because if we do any of these social distancing measures too early, then potentially people will get a bit bored and fed up, and they'll start emerging from their houses where we've asked them to self-isolate for several weeks, right at the time when they're most at risk of being infected. So, and I think that is the biggest challenge, because we're going to ask people to take some really drastic actions for a long period of time. And then there might be something about doing some of these measures locally rather than nationally. So we think that some areas of the country are a couple of weeks ahead of other areas of the country. So it may be that there might be some local measures that will be put in place in a particular region to combat the spread of infection in that particular area. So basically all of those social distancing measures, all of those interventions have been weighed up in terms of the impact on society and the impact on the epidemic curve. And it's ministers who have decided which of those interventions we're going to use, but it is the scientists who are going to determine when we put them into place. So I think one of the key questions that keeps coming up is about why aren't we closing schools? Because surely we wouldn't want children to be, that's basically a mass gathering, isn't it? Having, several hundred children together in the same place. And if this were flu, that would be a really good idea, because we know that closing schools during a pandemic would have a significant impact on the number of people who could be infected with pandemic flu. But actually, this is a completely different virus. So whereas pandemic flu does predominantly affect young people, this particular virus doesn't. And in fact, when you look at the mortality rates, it's not until you sort of get over the age of 50 or 60 that the mortality rates really rise above 0.01%, which is really, really low. Schools would have to close for a really long time, so we're looking at anything between 9 to 13 weeks potentially if schools closed. That's a long time to have schools closed. Children would probably be mixing anyway, but not only that, somebody would have to look after them, and the likelihood is that somebody might be grandparents. That's just the group of people who we're asking to self-isolate for a long period of time. And of course there's a big impact on the workforce. So, from our own perspective, we've got a substantial proportion of the workforce who are women. Often it's women who take on childcare responsibilities. When we look at the public sector, nursing and healthcare professionals, a large proportion of those individuals are women. So it would have a massive impact in terms of the delivery of many public services. So we think that actually for schools, the impact that closing schools would have on this epidemic curve would be really minimal compared to the impact that it's going to have on society. And that's why there is a reluctance to close schools, but it is, it's just under review. So why should we listen to the government advice? Because there's been loads of people out there who have challenged the direction of travel that the government has taken. So I just thought it would be worth taking the time to explain, who is involved in providing the advice to government. So the guy at the top is the Chief Medical Officer. That's Chris Whitty. So he is an infectious disease consultant. He is an epidemiologist, so that means that he's an expert at studying the distribution of disease, and he is a national and global public health expert. In fact, he was on the front line of the Ebola outbreak a few years ago. We've got the Chief Scientific Officer. He is a physician. He's got a really good understanding of drug research and development, and also has got a lot of experience in managing large data sets. And of course, that's what we're looking at, is what can we get from large data sets. And these are all underpinned, or these individuals are underpinned by advice from SAGE. And SAGE is basically a group of experts who are brought together for any emergency, but the experts are obviously dependent on the emergency. So these guys are all experts in infectious disease, and in particular infectious disease modelling. And there are about a dozen universities who are working on a daily basis with the data that is constantly being churned out from the World Health Organization, from Italy, from China, from our local surveillance systems. They are developing, or have developed, hundreds and hundreds of models and scenarios on which the government is basing their decision making. And then we've also got Public Health England. You know, we do have the best public health system in the world, I think. We have a really effective surveillance system. They are leaders in disease diagnostics. In fact, Public Health England were the first, we were the first country, more or less, to develop a diagnostic test for this particular infection. And of course, they're experts at managing infectious diseases. So I suppose what I'm saying to you is that, you know, if you've got the choice between listening to Piers Morgan or the latest winner of Love Island, or you can listen to the Chief Medical Officer, I would probably listen to the Chief Medical Officer, because I believe that he is giving us sound advice. This is just an overview of the national and regional emergency planning arrangements. So each police area has a local resilience forum. So we have a Northumbria local resilience forum, and we're now having weekly teleconferences, and that forum brings together all of the basically emergency planning category 1 responders. So that's the NHS, Public Health England, local authorities, NIAS, Fire and Rescue, and a whole load of other players to discuss how we manage this incident across that local regional forum, local resilience forum area. There's a health strategic command group. So that's basically all of the sort of health services feed into that. They feed into the strategic command group. There are links into the NHS, and that's being controlled quite centrally, but there are local arrangements which are being delivered on both a CCG and an integrated care partnership footprint. And of course there is going to be a requirement, like there was in Brexit, to report directly to government about our activities. And then on a more local basis, we have a weekly teleconference between Public Health England, between directors of public health and the strategic command group. I've talked about the Health Strategic Command Group, and then as a group of North East Directors of Public Health, we're also in almost constant communication to try and ensure that actually we give consistent advice as Directors of Public Health across the whole of the North East. So I think there are 5 things that we should be promoting to our communities, and the first one of these is really simple. It is about washing hands and good respiratory hygiene, because everything that we know about this virus is that it is a respiratory virus. So how do you catch a respiratory virus? Well, you catch it by somebody coughing and sneezing all over you, or you catch it by picking it up from microphones or computers or slide widgets, and then touching your face, and that's a really good method of transmitting viruses. So what we're asking people to do is, obviously, if you're going to sneeze or cough, try and sneeze into a tissue, and then catch it, bin it, kill it. And we're also promoting hand washing. That's just good hand hygiene. We should be doing that anyway. But both of those things will really reduce the risk of catching this virus, and we really need to interrupt the transmission of it. Everybody obviously needs to be prepared to self-isolate. There's loads of guidance on the gov.uk website about what social isolation means and how you can do that in practice. It's a bit adult-centric, so if you're trying to isolate at home with a child, you just need to try and apply those principles as well as you can. I think we need to, particularly now, think about planning ahead, because this is a marathon, not a sprint. So how are we going to maintain all these social isolation measures for many weeks, if not several months? We need to make sure that we use health service wisely. What we really don't want to happen is for people who are symptomatic to either go to the local pharmacy, go to their GP, or go to hospital. Please don't do that, and please encourage your residents not to do that either. We'd much rather that people sought advice online using the COVID-19 online NHS 111 link, or phoned NHS 111, or phone your GP. And finally, there's something about using trusted information sources. So please go to the .gov.uk website or the nhs.uk website. That's where you're going to get the latest guidance and definitive sources of advice. And I think there are, as elected members, I think your role is absolutely critical, because I think what the government has said right from day one is that we're not going to get through this unless we mobilise and motivate the assets that we've got in our communities. And you are community leaders. You are key to mobilising these assets and ensuring that people get the right advice. So let's be kind, let's be considerate, let's not stockpile toilet rolls. It's really not very helpful. Let's ensure that we leave nobody behind. There'll be lots of people who aren't in contact with services that we as a local authority don't know about. But you do. So please contact them, and let's make sure that we've got some system in place to ensure that everybody is kept connected, because we want to isolate people from the virus. We don't want to isolate people from society as a whole. I think you're the experts in your communities, so we need to make sure that we get, make maximum use of the groups that we've got, but probably not as a source of expert advice. We need to make sure that we support vulnerable and isolated people, and that's not just people over the age of 70 and people with long-term conditions. We've got some really vulnerable families in our communities, and we need to make sure that we support those as well, because I think there will be some economic hardship that will become apparent as this epidemic progresses, and we need to support those individuals as well. And lastly, let's just reiterate that information about where to go for trusted sources of advice, because it's really easy for people to get the wrong end of the stick and for myths to be spread across our communities. And actually, if you say something often enough, people really do start to believe it.